Thank you, and I'm especially honored to be here. And this page is very close to my heart. I'm Hungarian. Köszönöm a meghívást. And it's where my career started in a way with the University of Page Roundtable in Applied Linguistics that was organized by Marian Nikolov, a young learner specialist. And it's a pleasure to see some of the colleagues after so many years that we used to have those roundtables. And I have a very fond memory of those. Right, so my talk is going to view diversity from a slightly different perspective, and from the perspective, not the perspective of language diversity, but the diversity of our candidates, and in terms of how diverse they are in terms of cognitive characteristics and individual characteristics. So we are going to consider how we can increase test fairness for a group of test takers who are neurodiverse, and within this we are going to delve deeper into the use of special adjustments. So the theme of the conference is inclusion, and I thought I'll start by briefly explaining what we might mean by inclusion in assessment. And this is one possible conceptualization. There can be many others. So first of all, what is important is that we really need to increase the participation of students in and reducing their exclusion from classroom formative, summative, and high-stakes assessment. So inclusion is about participation and enabling participation. What do we need to do to achieve that more students participate? First of all, we need to start by restructuring the cultures, policies, practices of assessment so that they respond to the diversity of our students' needs. We also need to reduce barriers for fair and just assessment for all students, not just those who have disabilities or who are special or different in one way or another. And inclusion is a process, although it sounds like a completed noun in English. We always have to learn from our attempts when we are trying to reduce these barriers and to make further improvements in our practices so that students benefit more widely. And finally, we need to view the difference between the students as resources to support learning rather than as problems to be overcome. And I think this is very important, that we need to change our attitudes. And I think the slides are on automated play, so on automated timing. So one way to do this is through universal design. And what universal design in assessment means is that we need to think about an inclusive assessment population, something that Anthony has already started discussing in his presentation. We need to work with precisely defined constructs, again, something that was touched on in Anthony's talk. We need to produce accessible and non-biased items for our test taker populations. And we have to create tests that can be easily accommodated should we have students for whom universal design doesn't serve as enough in terms of accessibility. We need to have simple and clear intuitive instructions and procedures. We have to ensure maximum readability and comprehensibility of our tests and maximum legibility. So some of these are kind of self-evident. What I would like to focus and zoom on to is the accommodations, the amenable accommodations, because we need to consider what happens if our general good practice universal design doesn't provide sufficient support. And in this case, we can provide students with accommodations which do not change the construct that we assess. And these are changes that we make in the presentation or in the response format of our test or the test administration conditions, right? So the construct remains unchanged. We sometimes also have to change our test in a way that the special adjustment becomes a modification. And here, the construct is impacted. For example, we only use a portion of a test for a hearing impaired candidate. For example, it's unfair to administer the listening component. We can give them the transcript, but that already has an impact on the construct. Or we use a substitute test or alternate assessments. Now, when you look at this definition, it seems easy to differentiate between the two. In fact, it's quite a complex endeavor. And it's not easy to decide what's an accommodation and what's a modification. And there are some questions that we need to ask when we make these decisions, and when we research the impact of accommodations and modifications on our students. So first of all, the basic question is there an impact on test-taking processes and cognitive and construct validity of the test, right? If it does, accommodation. If it doesn't, modification. But very often we can only find this out through think-alouds or a detailed inspection of the test-taking processes. Then we also need to think about whether there is a differential impact of an accommodation on the scores of students who are disabled versus those who are non-disabled, right? Because if we give an accommodation and if we find that everybody benefits, then we need to think about it as a universal design feature. Or if we find that an accommodation is actually not helping at all, but in fact makes the performance of the students worse, then it's not really a useful accommodation. And then we might also want to ask whether there is an impact on certain construct-irrelevant factors that interfered with test performance. So that's an indirect effect, right? So what is the effect of an accommodation on test anxiety, which then has a knock-on effect on test performance, right? So, who might need special adjustments, and I'm going to focus on one group of students who we might label as neurodiverse. Who they are, they can be students or candidates with dyslexia or reading comprehension difficulties, dyscalculia, numeracy problems, dyspraxia, dysgraphia, depending on which country you come from, they are differentiated, or dyspraxia might not be even recognized in your country. Then ADHD and autism spectrum also belong to neurodiversity. I'm not going to define these or discuss them in detail. I think you probably have a basic understanding of what they are, and Benjamin is going to talk a little bit more about dyslexia in the next presentation. So what can we offer to these test takers, and what do test organizations usually differ? First of all, we can give students accommodations in the test setting. We can change if we have the means to alter the lighting conditions, not so bright lights or more light. Some students might need it. Students with ADHD might benefit from noise buffers, so noise cancelling headphones, or just simple earplugs, or administering the test individually or small groups, right? Simple, but sometimes administratively not so easy to provide, right? And these obviously don't have any impact on the test construct. Now, we can also give accommodations in how we present our test. I collected the accommodations that are usually provided by testing organizations. One is, for example, responding directly in the test booklet rather than an answer sheet. Sometimes students are asked to transfer their responses on an answer sheet. If you have ADHD, you are bound to make mistakes and lose points here. Printing tests on colored papers or the colored overlays, making the paper less busy by having adequate spacing, use of a screen reader or assistant reader, and larger font size or spacing. So these are some of the common ones. But if we come to think about them, then this one could be a universal design feature. This could be given for everybody. Printing on test papers on colored papers, again, this could be made adjustable in a digital test, making the paper less busy. Again, it could be a universal design feature. And this one can be a modification depending on what it is that we are assessing. And then larger font size or spacing, again, can be a universal design feature. So even the traditional lists that are provided by testing organizations could be either given to everybody, or some of them might actually result in the modification of the test construct. Now, in terms of response formats, so how the students respond to the test, some of the typical accommodations are using organizational devices such as a highlighter tool. Again, this could be a universal design feature offered to everybody. Using scribes or speech-to-text software. In some cases, for example, for a writing test, it could be a modification, but in some cases, like dictating the answer for a reading comprehension test where you have short answer questions, it is not. Use of computers for writing. This is now almost the standard procedure for digital tests, or I think it could be a universal design feature, of course, depending on the context, because in some low-resource context, you don't have this. Then things like providing line sheets in paper-based accommodations, word count if you have a digital test and you have a writing component is really helpful. If you observe students how much time they spend counting the number of words when they're writing. Timer can be, again, very helpful because you see how much more time you have, but it can also be a source of stress for some of the students. So again, some of these can be universal design features. Now, another very frequently given accommodation, and I left it for one of the last because this is where I would like to talk more, and that's where my research has been centered around in the past few years, is giving students time extension and additional breaks. And then testing organizations or even classroom assessment varies from 25% to 50 to 100%, and then you can give students multiple or frequent breaks or testing over multiple days if it's a long test, right? So, surprisingly, there was very little research on the impact of time adjustments or any adjustment for test scores in the field of language testing. There was already research in other fields, but very little in language testing. So in one of the first studies that we conducted, and a lot of this research was actually conducted in Hungary, so this study was also administered to Hungarian students who took the APTIS Young Learners Test, and they took the test under two conditions: extended time and standard timing conditions. And the students were not classified as having dyslexia or no dyslexia, because again, those of you who come from Hungary, we don't have a very reliable system of dyslexia identification. So we used predictors that you would test that could predict dyslexia, and we used this as a continuous variable. So what we found was that the timing condition didn't influence the score, neither for those who had kind of dyslexic traits nor for those who didn't, right? One of the reasons we thought was that the APTIS Young Learners Test was originally very generously timed. So I repeated this study again in Hungary, and here I took an older generation of students, secondary school. They took a longer test, the first certificate English test, the sample one that is online. And I also measured the students' reading anxiety, used the same design, continuous variables. What I found was that students who had high literacy skills, high reading ability in Hungarian, they were actually slower reading in English. I timed them with a timer, how long they took in the test. So these students were careful readers in English, right? But then when low first language reading ability in Hungarian was paired with lower second language reading ability, then the students were slower, right? So that shows that to some extent there is a mediating effect of first language skills and second language skills, but it is only apparent if students have lower level of proficiency. And also anxiety influenced test taking time. So in a way, test taking time in reading has very little to do with the construct itself, and it's also shown in terms of timing data and ability. So one of the conclusions I drew from this is that flexible test taking time should be considered as a universal design feature, and we should really measure how long our tests take in the piloting stage and give a generous margin. I conducted a very recent study, which hasn't even been published, so you are one of the first few people to hear about it. It was sponsored by TOEFL, and again, Hungarian university students took TOEFL IBT in an accessible format, and I interviewed them after they took the test, and they were again given flexible time to complete it. What you can see on these slides is that the medium line, so the blue cutoff point, is about where the standard testing time is, but a lot of the students needed extra time, and not just in the reading test, where even the medium time is well above the standard completion time, 35 minutes. The medium is, or the kind of mean value is around 45, so these students were really slow in the reading test, but they would also have needed a bit more time in the listening test to read and deliberate on the answers. They needed more time for one of for the integrated writing task, and they needed a bit less time for the more simple opinion kind of forum response task, right? So basically what it shows is that neurodiverse test takers, the students who had SpLDs, and some of them also had additional ADHD, they need extra time, not just in reading, but also in writing and listening assessment. So if you design your tests, it is important to consider that these students do not just have reading-related difficulties. How did they use the time and the reading and listening test? They used it basically to support their performance, and none of this kind of interfered with the construct validity. They read the input text, especially those who had ADHD. They had to reread and go back. They were thinking about the response options. It took them longer to understand the task instructions, and a lot of them said that it reduced their stress level. In the listening test, again, they read the response options longer, and they really were trying to take short breaks when they were answering these test items to refocus their attention and to be able to concentrate, right? How did they use the extended time in the writing test? A lot of it was devoted to content planning, which is very important, right? This is something that we want to assess appropriately. They wanted to show their best abilities in terms of lexical choice and grammatical sophistication. They were revising and editing their text. So these are all processes we want to assess, and we want to make sure that students perform to the best of their knowledge. They also had to cut sometimes the text to fit the word length limitations. They had to read and understand the task instructions. And then some were tired, and they just kind of took these interim mini breaks as part of the extended time. Right? Interestingly, the students also talked quite a lot about the extended time when we gave them more time to prepare for the speaking response. This is a digital test, and usually the standard thinking time is 30 seconds in TOEFL IBT, or sometimes 20 seconds. I asked TOEFL IBT to increase it to 60 seconds, right? And this is traditionally not given as an accommodation in TOEFL IBT, but the students were really grateful for this opportunity. They used it for rereading task instruction, planning their messages, taking notes, rehearsing their speech, thinking about word choice, and they said this is something that derives from their disability, that I don't really like speaking tasks because I do not have enough time to gather my thoughts, and sometimes I even find it challenging to do this in Hungarian, right? So this is something, gathering your thoughts and giving a coherent response if you have SpLDs or ADHD is challenging given under time pressure, right? So again, this is important to consider. So to sum up the findings about timing, neurodiverse test takers might need additional time in all test components, but you could also see in my previous studies that test taking time is also influenced by other factors, such as anxiety or first language reading level, and you should be considered, if possible, you should consider it as a universal design feature. I also asked the students in my research to predict before they took the test how much extra time they would need, and they were really inaccurate in predicting the time. So that's again important because the students fill in a form and they will tell you, I need 50% time. And then a lot of the students who said I need 50%, they actually needed 100%. And a lot of the students who said, oh, 25% will be enough, they again underestimated, or some of them even overestimated the extra time they needed, right? The students really found the breaks very useful. In my research, they were allowed to take a break anytime, even within the test component. And they said the break was definitely useful because I could recharge, clear my mind, and focus better. And because I wanted to give voice to the test takers, I have a video of an avatar, and I hope it works. So just to hear what one participant said.
Well, a student who has a learning difficulty certainly needs a break. I can't imagine them doing it without a break, especially in an exam situation. For a person with a learning difficulty, it's a much bigger effort than for anyone else. So I used to say that for a person with any kind of difficulty, it's at least 3 times more difficult to do the same task than for someone else.
Right, so I think that's a nice quote from one of the participants. Okay, one other area of research that I have done some work on is the use of read-aloud. So when students can read and listen to a text at the same time. And actually, TOEFL provides it as an accommodation for students with dyslexia. But read aloud, strictly speaking, is a modification in the case of a reading or listening test. We did a study back in 2018 in Slovenia where we investigated whether reading and listening to a text does actually have a beneficial effect for text comprehension. And we found that it had a positive effect on scores for the difficult input text for the dyslexic students. So they actually performed better in this multimodal condition. In my recent TOEFL research, you can see on this slide that not everybody used the opportunity to read aloud. There was an icon that they could click on. And for the reading input, around 22 students used it and 13 didn't. Very few students used the option when they could listen to the items themselves. In the listening test or in the reading test. But what you see here, and what was very interesting, as they were getting towards the end of the text, and TOEFL has integrated test types, and when they got to the integrated writing test, then almost everybody used the read aloud, even though the text was short, because they were getting tired, right? So again, that speaks to some of the universal design features of read aloud, especially if we consider it a reading or listening as a multimodal construct. But how did the students use it? What did they say it was beneficial for? One of them said it was helpful that I could listen and follow the text, my brain could rest, and I could concentrate better. Good. Helps with slower reading speed. I think that's also good. Supports text comprehension processes. That's already starting to interfere with the construct. And this is what 6 students said. Helps recognize or infer the meaning of words that they were not familiar with based on the written form alone, right? So clear impact on the text construct because we want the students to recognize the written forms. And then there were also reasons for not using it, doesn't assist comprehension processes, interferes with concentration, and faster reading speed than the pace of the recorded text, right? So if we do consider this, then we really have to ask ourselves, is this an accommodation or a modification? And again, it depends on our definition of the construct itself. Right, oops, am I going? Yeah, and then finally the spell checkers, because again, spell checkers are possible in TOEFL IBT. Students found it helpful in the writing test, but a lot of them were using it for words that they didn't know how to spell accurately. They had partial orthographic knowledge, so again, it really interfered with some of the writing processes that we want to check, unless we say that spelling is not part of the writing construct that we want to assess in our particular test, right? So, some final thoughts on accommodations and inclusive assessment. I think we really have to consider what can be provided as a universal design and accessibility feature for all students. to minimize needs for special adjustments, because you are all test takers and you know how long it takes to gather all the evidence, make the decisions, provide the adjustments. We have to make the application for special adjustment transparent and accessible and easy. And some of the testing organizations really need to review their policies and websites for this, because they are not necessarily transparent. Most disabilities have permanent impacts, like ADHD, dyslexia, and a lot of the testing organizations require very recent certificates, and that costs a lot of money. And we really need to consider how necessary it is and how fair it is to put that burden on the test takers. We have to consult the students and other stakeholders on special adjustment and accessibility arrangement policies, and I think that's what Magda, right? Magda's presentation is going to be, and then give student opportunities to practice using special adjustments and consider what additional support students will need in the test preparation process. And we need to do more research and review the accessibility and special arrangements for our tests periodically. So thank you so much for your attention, and thank you to all my collaborators, including Benjamin and colleagues in Innsbruck and Ljubljana, and these are some of the publications where we discuss this in more detail. Thank you.